Times have changed, and how? All of you who use intraoral scanners in your daily practices will surely testify that digital impression workflows for implant level scans have become highly predictable and are an absolute breeze to follow. Clinically, however, we still do come across certain situations or challenges, especially when it comes to scanning multiple implants together. So I'm working on one such case here where I have received this scan from one of our dentists who was having a so-called challenge when he was trying to scan the scan bodies. And as you can see from the first look, it seems pretty straightforward. 6 implants in the lower arch, and we want to make a screw retained prosthesis on these. Now the scan body part was something that the dentist kind of struggled with because of a very common event that happens very frequently. Let's take a look. So this is the model that we printed for this case, and you can see that the analogs have already been set up inside this model. Let's take a closer look at the left side of this model where there are 3 implants. I'm going to now try and place the relevant scan bodies onto these implants, and I can do that without any problems at all. I can follow my usual scan protocol and make a scan of this. Now let's see what happens on the right side. I'm going to try and put the scan body on the distal most implant, and that's not bad at all. It goes in and engages straight away. Let's do the same with the one in the middle, and that's engaging as well, so no problems there. Now here is the challenge. If you closely look at these scan bodies, I think you will be able to predict what happens next. The moment I try to engage the scan body on the mesial implant, do you see what happens? I'm unable to seat it correctly because of the proximity and the angulation of the implant in the middle. Even though I can feel that the scan body is tightly screwed, you will definitely see an air gap right there when you shoot an IOPA to confirm seating. This in fact is a very common occurrence in the clinical implantology setting and makes impression making nearly impossible. But the good news is that when you use an intraoral scanner, there is a way to counter this problem very easily. Let me show you how this works. So the first thing I will do is engage the 2 terminal scan bodies inside the mouth. Obviously, I'm showing this to you on a model for better visualization, but the process remains exactly the same inside the patient's mouth. The scanner goes in and we scan the 2 terminal scan bodies as per the regular protocol. Once this is done, we replace the healing abutments onto these implants after removing the scan bodies, and now is the time to do all the magic. If you see here, I have this lock scan feature. This is what we need to use to record scan bodies in these kind of cases. Once this tool is activated, I can paint on the surfaces of the scan that I want to lock. Once this is done, I can go back to the patient's mouth, place that scan body in the middle, and now that the terminal scan bodies have been removed and locked in the scan, we are now free to record the middle scan body and merge it to the original scan. And it's as easy as this. And you can see that in spite of the other scan bodies not being there inside the mouth, they will still be retained in the scan because we use the lock tool. That's only possible because of the beautiful features in this software. And this to me is one of those immense benefits that digital dentistry has to offer. It just makes life so much easier for practitioners and labs alike. You can rest assured that this scan here will now give seamless results and enable the technician to send you an accurate and a passive implant prosthesis. So that was the solution to one of the most commonly encountered problems in implant dentistry. I hope you found this video very helpful. If you did, please share it with everybody, like it, subscribe to the channel if you haven't already, and keep watching Chairside Education.